Post-traumatic stress disorder, or PTSD, is an emotional illness that is classified as an anxiety disorder and usually develops as a result of a terribly frightening, life-threatening, or otherwise highly unsafe experience. PTSD is said to occur in 1 in 5 firefighters, 1 in 3 teenage survivors of car crashes, 1 in 2 female rape victims, 2 in 3 prisoners of war. You can develop PTSD when you go through any event that causes intense fear, helplessness, or horror. Flashbacks, upsetting dreams about the traumatic event, trying to avoid thinking or talking about the event, feeling emotionally numb, avoiding activities you once enjoyed, trouble concentrating or remembering, difficulty maintaining close relationships, self-destructive behavior such as drinking too much, divorce, and suicide are all symptoms of PTSD. As another symptom, people with PTSD may disconnect with their families and avoid social situations. Friends and family should try to keep their close relations with the trauma survivor in order to help with the PTSD. Steven served in the Marines for 3 years in Iraq. His job was to detect IEDs. He was severely injured after an explosion and does not remember the event well, but he remembers waking up in the Naval Hospital in Maryland and talking to a counselor about the guilt and stress that this event caused him.
I went to go see a Navy counselor there. He'd come in and, "Hey, so how are you feeling?" "I don't know, I'm feeling fine." "Oh, how are you sleeping?" I guess I'm sleeping fine. I don't know. "How's your sex life?" "Wait, why are you asking me this? Why are you asking me this stuff?" And he was like, "Well, I need to get to know you." So it was a lot different. You know, this guy wasn't just sitting there telling you that something's wrong with you. He's letting us figure it out for ourselves. And he said, "Okay, well, hey, why don't we go out to lunch one day?" And so we go out to a mall. He said, "We're gonna go to the food court." And I said, "Nope, not going in there." Because you get that feeling where your chest starts getting tight, you're having trouble breathing, you start sweating a little bit, and that's I guess you could call it a panic attack, but it's the symptom, one of the symptoms of PTSD, and you start feeling.
Steven's doctor used exposure therapy as a treatment for his PTSD. As Steven said, he did not like the idea of eating in the crowded food court because of the fear that this traumatic event caused him to have.
I still have problems sleeping. I still get the nightmares. I still get the intrusive thoughts. But being able to talk to other veterans, that's the way that I heal, because I'm constantly getting it out of me. We're always given an objective. We're always given a mission. When we come back, we don't have that. And so we feel lost. We don't have direction.